Period clots can be anything from like a jelly consistency to maybe a jam consistency. And I really mean like jelly and jam, like you spread on toast. You see some of these images, it really does kind of look like this. And the color of period clots can be anything from red to a darker red to even sort of a dark, almost blackish like color, depending on the size of the clots. Now, I first want to start off by telling you the size of clot that should send you to your doctor. This is a quarter, okay? And if your clots are the size of a quarter or larger, that should send you to your doctor to get evaluated. What I'm saying is that you can have clots as part of your period, especially if you have heavy periods, but they really should be smaller than the diameter of a quarter, okay? So this actually gives you a nice visual reference, and you can kind of see. Oftentimes we get clots more in the beginning of the period rather than the end, but everyone is different, and of course it's going to depend on the heaviness of your cycles as well. Guys, I'm Dr. Jen. It's good to see you. Now I'm going to tell you what clots are made up of, but I'm also going to tell you signs that your period might be too heavy, meaning you need to see your doctor to be evaluated for any potential underlying causes. Okay? So this is the thing. Remember, when we have our periods, it's the shedding of our sort of our uterus. The lining of the uterus is being shed, and that's what's sort of being expunged. But in that bleeding and the shedding is a combination of a lot of things. It's tissue from the uterus lining. It's blood cells. It's proteins. And it's kind of like this. You know, if you think about if you cut your arm or things like that, when you're bleeding a decent amount, your body works to clot that blood so that it stops bleeding. That's what your body does when you have period bleeding as well, especially if you have a decent amount of period bleeding, okay? So clots in and of themselves are not abnormal. The size of the clots is something I really want you to pay attention to, because if it's a size of a quarter or larger, that is considered abnormal, something you should see your doctor about, okay? Now, there are some other things, other sort of guidelines about your periods I want you that would need you to see your doctor, okay? So heavy periods, if you bleed for longer than 7 days, you should talk to your doctor about that. If you soak through one or more tampons or pads every hour for several hours, meaning you just go through them every single hour, that's a really heavy period. You got to see your doctor about that. Also, if you need to wear more than one pad at a time, you should see your doctor about that as well. Or maybe if you're wearing tampons and pads, you've got to see your doctor about that. If you have to change your tampon or pad throughout the night because you bleed so heavily, got to see your doctor. And then, of course, as we mentioned, if you have clots the size of a quarter or larger, that's something to definitely see your doctor. I would also say, like, if you've got a lot of clotting, like ginormous amounts of clots, something to see your doctor for. When we talk about like the heavy bleeding aspect, the reason why you need to see your doctor and why I'm talking about this is because sometimes as women, you know, we just know what we have. We know that we've been bleeding like this for the beginning of time, and it's not unusual to us, but it actually may prompt a doctor to look further into underlying conditions. Oh, I should also say, any like really sort of excruciating pain with your periods, painful periods, you need to see your doctor. Why? Because all of these criteria, we want to make sure you don't have something like endometriosis or a thyroid condition or fibroids or something else going on. Too many times, again, we sort of deal with periods that actually may not be normal but feel like our normal, when there actually could be something underlying that could be fixed or improved upon, okay? Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, etc. Guys, sign up for my free health newsletter there. Guys, I'm Dr. Jen.